So as per our trends that we are doing it in YouTube and Instagram live. Instagram I normally try to take a either a rubric or a remedy, and YouTube I would like to be putting only on the question answer session because a lot of questions are unanswered and I'm not able to answer because when I'm speaking about mathematical rubrics, I normally don't look at the questions. So first we'll do the questions because there were some questions on Instagram also which I was not able to answer because of this scarcity of time. So you can start asking questions and let us see uh, how we uh, do the question answer session. So if there are no questions, I'll just take one thing that hello Shiv Prasad, and I was just talking in relation to speech. Speech. Now, whenever we are talking about speech, speech is something which if speech is something which when the patient comes in your chamber, he starts speaking, and you can. These is are the very non-verbal communication, speech, where you can understand the tone of talking, you can understand the voice of the patient. There are different things which you can basically understand, and I would not say just prescribe the remedy in that speech and voices, but it would definitely help to confirm some remedies. For example, I'll just tell you something about speech if I have no questions or yeah. So welcome Dr. Shivrasad, Dr. Chawla, Dr. Babel. So this is Dr. Shiv Prasad, Telangana State Homeopathy Doctor Association State President Mobile. Yeah, welcome Dr. Shiv Prasad. So I was just telling you something in relation to voice. Don't prescribe only on voice, but there are some entry points which are very important to understand in relation to voice. For example, there are some patients whose voice is very deep. When he starts speaking, the voice is deep. The voice is, ऐसे लगता है it feels as if the voice has a lot of power and depth. There is a lot of depth in the voice. You have remedies like a carboage or phosphorus or causticum or drosera, very deep voice. And sometimes when the patient is talking in front of you, uh, I just answer one question. Sir, can we repeat lycopodium potency too frequently? Yes, why not? You can repeat your LM potency and you can repeat till you find that the aggravation starts and then you can stop it. That is given in organ of medicine. You can read that, you can repeat it. So the voice. Now there are some patients, when they come inside the chamber, they start talking and you feel that after some time the voice keeps changing. So voice changeable. Don't tell me the remedy pulsatilla because everything changeable is not pulsatilla. Of course, pulsatilla is there, but changeability is important. So voice changeable, a very important and a very interesting remedy you will come to, that is Argentum metallicum arsenic album. I have seen in a lot of cases where voice is changeable. I treated case of, yeah, very good. Very Dr. Shivrata is very nice. So voice changeable again is a very important symptom. Sometimes when the patient speaks, the patient speaking, and the voice gets cracked. The voice gets cracked, and whenever if you have this symptom, the voice is cracking, think about spongia. Sometimes it happens when the patient starts singing and his voice cracks. And when the voice cracks, the patient comes to you because he or she feels that when he is singing, she is not able to have the same tone because the voice gets cracked very frequently, and you must think about spongia. I have a very interesting case where uh, every time when I go home, one of my security guard, his voice is like, when he speaks, no, he speaks like this. Arey, when did you come? Arey, you are late. I should have opened the door. His voice is as good as barking. And normally also when he speaks, it feels as if he is barking. This is called as a barking voice. Canther is very important for barking voice. Nitric acid, belladonna. Of course, there are other remedies also, but these three remedies I have seen so many times in my practice where the voice is barking. How many times a day can we repeat LM potency for how many days, sir? Please clarify. Uh, it depends upon cases. For example, I had a case of fever 3 days back, so I prescribed the patient Nactromure 01 every 1 hourly, and by the time evening the fever was normal and I stopped the remedy. So it depends. Hahnemann says in the organ of medicine you can repeat this medicines every 10 minutes also and 15 minutes also, depending on the severity of complaints. As the severity of symptoms comes down, automatically start to taper the dose. For example, in case I had a case of migraine just today only, I prescribed the patient sulfur 0 by 3, that was once in 3 days. Now I prescribe the patient sulfur 0 by 4 once a week. So it depends upon the how the patient is reacting or how the patient is responsive towards your medicine. In acute, you can repeat very frequently, there's no problem. Changeable voice or broken voice or barking voice, these are very, very important things to. The patient is not going to tell you, you have to, this is an objective symptom, no? And we have a very interesting voice is very hoarse. Now you have to differentiate between the voice hoarseness and bass voice. There are two differences. So make sure that you differentiate between hoarse voice and a bass voice. Hoarseness of voice, there are a lot of remedies. So whenever in a rubric there are a lot of remedies, 300, 400, then you have to see the sub rubrics. For example, hoarseness of voice more in the evening, more in the night, in the morning while getting up, or it is very, it becomes very chronic sometimes, or it comes and goes, or hoarseness of voice because of cold, hoarseness of voice after eating, or hoarseness of voice before heart complaints, before menses, after menses, or hoarseness of voice because of overuse of voice. We have remedies like causticum, capsicum, aurum, terphyllum, argentum, nitricum, argentum, metallicum, rustox also. So these are very, very important symptoms where voice is very hoarse and painful. So whenever the patient comes and tells you voice is hoarse and painful, there may be a lot of remedies, but two remedies I have seen very, very important in my practice. First, phosphorus. Second, argentum, again, argentum metallicum. And voice, hoarse, painful, and then we have painless. So painless you can think about, again phosphorus is there, calcareous carb is there, and antim crude is there. But I have seen cases where the voice is painful and hoarse more in phosphorus rather than painless. So if you ask me, my observation is painful voice is more in phosphorus. So these are the type of voices you have to understand and remember. There are other things also, voice hollow and voice husky and all, which I have not seen in my practice. So I cannot answer that question because there are so many questions in regarding voice which I had it. Now sometimes patient tells us that, especially I had a case where it was a case of a teacher. She was teaching for the past 20 years, and she says gradually, in about 2 or 3 years, my voice becomes less. Now I have lost my voice. So voice lost because of overuse of voice. 3 remedies which I have found so useful in my practice, and that lady also I prescribed the patient causticum, and that treated the case in 15 days. So whenever you have hoarseness or you have voice lost because of overuse, think about causticum, think about argentum nitricum, think about Merxol, and of course think about rustox also. I hope you're understanding the importance of knowing this non-verbal communication voice. If you are not able to understand, please do ask some questions, or we can shift to different topic. But because this topic was, there were a lot of questions regarding non-verbal communication in regards to voice. That's why I am taking this webinar on voice. Now you have voices. These are the basic things which I see in voice. If you have any questions, you can ask and we can go forward. Now, very close to voice, it is speech. Now, sometimes the patient comes and tells you the speech is difficult. Now, if the speech is difficult, there are a lot of remedies and a lot of sub rubrics. And I'll tell you what I have seen in my practice. Speech difficult because of heaviness of tongue. This I have seen lots in my practice. Speech is difficult because of heaviness of tongue. Of course, The first remedy that you should always think about is gelsemium, a classical remedy for paralytic conditions, paralysis of single part in anywhere. So the remedy is gelsemium. Also think about lachesis, also think about anacardium, and also think about Crotalus cascavela. I hope this is okay. And speech difficult from weakness, my dear friend. This you will see lots in your practice. The speech is difficult from weakness. Always think about first drug, natramur, and second drug is ammonium carb. And the patient says that the vocal cord is weak. Doctor says the vocal cord is weak, and because of that there is difficulty in speech. Natramur, ammonium carb, and glonine. I have used natramur in many of cases, which very good results. This is in relation to speech. Did you understand what I want to tell anyone? You can see, keep asking me questions, because if you don't ask questions, I am always in answer. I am always busy. Yeah. So I have one question. 4-year-old boy, voice thin, type while morning, while awake, and okay after some time. This is a very typical symptom which which you will encounter in your practice. So if you have understood what I want to tell you, you will be able to appreciate that this is voice changeable. So voice changeable, he gets up, it is thin, and then it becomes normal. So it is changing. Neither it is broken, nor it is barking, nor it is higher, nor it is weak, nor it is cracked or deep, but it is changing. I had a case of a case of allergic rhinitis for about 2 or 3 years, not responding to treatment. I took this for prescription. I gave the remedy aurum triphyllum, and that treated that case. Are you with me, everyone? Are you with me? This is how we have to, sometimes it becomes difficult for us to appreciate the symptoms. A patient comes and tells you a mind symptom, and you rubricate that case for whatever reasons. That remedy does not work, or the rubric is wrong because you thought at that time the rubric was right. You change the rubric, you take element of suppression, then you take elements from humiliation, then you take chagrin, you take a lot of suppression, nothing works. So that is your interpretation according to what you have felt. But this interpretation becomes easy because you can hear the voice. The patient will not be able to manipulate the voice. Then you will be able to understand that symptom very precisely. Are you with me, everyone? So this is a non-verbal communication that everybody has to understand. Otherwise it becomes difficult for us every time to interpret a mental symptom. Am I right or wrong? Anyone? Are you with me? Am I making sense? That is important to you. Yes or no? Nobody has answered anything. Yes or no? Are you understanding what I want to convey to you? If you're yes, yeah, thank you. So sometimes it is difficult to understand. The mental symptoms, difficult to interpret. So these symptoms, which are non-verbal communication, will come very handy. Now, the non-verbal communication could be from any part of the world. That is what I am teaching my students who are working with me now. Non-verbal communication. They take a case, then I say, so see the speech, see the hair, see the skin, see the teeth, and then the remedy comes, and then we interpret the mind symptom and the remedy matches. So it is so important to understand that. For example, I've always tell you constipation or stools. We can take constipation, a basic non-verbal communication. The patient says, I'm always constipated. I have to always have a desire to go to stools. Now, if the patient tells you that I have always the desire to go to stools, but the stools are hardened, it is not diarrhea, it is not IBS, but always constant desire to go to stools. Now you cannot always give that remedy like alosecretan, argentum, nitricum, phosphorus. They are there, but if you see the metabolic, always constant desire for stools, a very important symptom of Crohn's disease also. I am irritable bowel disease also, and irritable bowel syndrome also. fantastic remedy, simple remedy, Naxomica, Conium, Maccar, Magmure, Pulsatilla, Silicia would treat that case. You will see in most of the complaints of stools or constipation or character of stools, magnesium carbon, magnesium mure comes very frequently in our repertory chart. So these remedies are repetitive. The patient comes and tells you that I have fear, I have a lot of fear, डर लग रहा है, I fear, I am not able to concentrate, I am not able to eat food properly, I feel what will happen, this will happen, that will happen, what will happen to my parent, what will happen to my friend, and he keeps on because of fear. It sometimes becomes difficult to interpret what to take. Fear because of fear of closed one, fear of relative, fear XYZ, and fear of imaginary things, fear of disease, and then so on and so forth. It becomes difficult. Ask the patient, my dear friend. I'm just telling you what cases I have treated, okay? Ask the patient. Keep after fear, what is that which has affected your body? Apart from the mental fear that something will happen, wrong will happen, imaginary fear is not. And sometimes the patient says, Doctor Saab, because of fear, I feel one thing, that I have become constipated. I am not going stools every day. I remember this has happened only after fear. And immediately you feel what is psychosomatic from mind to body, and this symptom the patient remembers very particularly, and this is a very particular important symptom, constipation from fear. Give the patient a dose of opium and you see the result of homeopathy medicine. Are you with me, everyone? Understanding, no? Psychosomatics. Sir, what medicine should I give as sunstroke prevention medicine, as well as planning to register to the police all over the state? My dear friend, simple remedy which I have been using it for years. I give only Natramure. I give Natramure 30. I'll just add one thing, my friend. Sometimes I have a big farm where basically I have a lot of plants and all, and some plants basically because of the sun they ripen fruit very early, very late. A lot of things happen. So I put Natramure 30 1 ml in 1 liter of water and spray over the plants, and you'll be surprised that the plants grow beautifully and they are not affected by the heat also. If you don't put that green, we put that green blanket over the plant. Natramure 31 ml in 1 liter of water. I have been using in my plants since so long. This is in relation to medicines. A lot of people ask me what do you put in the plant. So in summers I put Natramure. The same philosophy applies on human beings also. I give Natramure 30 before they go out in the sun, 1 dose, and when they come, 1 dose. Give it 2 or 3 times, then wait for some time, then you can repeat. That's what I do. See, there are a lot of medicines, then we have Glonine, we have Natramure, we have a lot of things. But the basic problem, in heat, what happens, you are drained of energy, you are drained of your electrolytes, and you're drained out of sodium. That's why what do we tell the patient? Drink salt and sweet water. Put salt and sweet and then drink, because there's depletion of electrolytes. That's why Natramure matches the doctrine of signature also and symptomatic also. That's why I prefer Natramure. Otherwise, we have Natramure, Natrum crab, Glonine, arsenic, belladonna, a lot of remedies. It is there are so many remedies, then you'll be confused. So simple what I do to human beings also and to plants also, that I have told you in my whatever I am doing it in my clinical practice. Sir, when patient says he gets angry when someone doesn't perform their duty, especially in the household, when someone ignores their work knowing without valid reason for a long time. See, this is a very, very common symptom. The patient feels that he or she is doing everything, but nobody is taking notice of her. That means she is not appreciated. So you can take, and if the patient is suffering because of this delusion that she is not appreciated, or you can also take elements from cares and worries because of that, and the patient feels indignation, which is wrong, and it is not taken care of. So indignation also comes in this way. So there are different things. This is a very common symptom which we like. I also sometimes this I'm taking YouTube live since years and years, and doctors are not coming online, and if they are coming, they are seeing after that. So I feel why it is happening, but that is not affecting me. If I start becoming affected, then the disease starts. For example, you see, sulfur is dirty. If you read Kent's Mathematica, the problem with sulfur is not dirtiness. He is not affected by the dirtiness. He does not feel okay if the table is cluttered. So what? There is no problem. He is not affected by the dirtiness. Arsenic is affected by the dirtiness. That's why he or she feels the pain of affection. Okay. So let us go forward. No, for me, natrium works very well. I have been giving it for years, and Mathematica, you can think about Econite, you can think of natrium, natrium carb, lacasis, pulsatilla, antim crude, gelsemium, naxomica, lot of remedies. Depends on what you are getting results. Confused between anger, indignation, elements from indignation. See, anger, indignation from means something has happened and the patient has reacted in anger. Elements from means the patient feels that there was indignation, he did not react, and the body reacted, and the patient can relate because he got migraine, he got stomach problem, he got IBS, he got IBD. He can relate that symptom to that elements from, and then the disease starts. That's the differentiation between elements from. If you if you open this a simple word elements from, it has a typical meaning elements from. So you go in the Google and search, for example, for what is the meaning of elements from. You will come to know the patient can relate to that. That is the importance of knowing elements from. And anger means the patient is reacting in that way. That's the difference. So you have there is a beautiful rubric in delusion. There is a rubric called as delusion wronged he is. Open the repertory. Delusion wronged he is. Are you with me? So if you go to that rubric also, you would be basically entitled for some remedy or for something which is very, very common. Delusion wronged he had suffered. Open the repertory if you have. There's a beautiful rubric, delusion wrong he has suffered. Remedies are, I think, Alzheimer's is there, China is there. There are other remedies also, but you can go and see that. So there's a rubric called as delusion, that people have done something wrong against her, and the remedy is lilium tig. So these are the different rubrics you can take in for prescription. I am postponed almost every task, even trifles, ask and upset and about myself. Yeah, you can see. I am postponed almost every task, even trifles, task and upset and angry about myself. Yeah, okay. Piles pain in anus after passing stool remedy. Very, very simple. Ask the patient. How much time. It is given in Ratania that the patient passes stools and there's burning and pain for hours after stools. That is Ratania. So let us go see pain after passing stools. Basically, you have lots and lots of remedies. Simple remedy you can think about. First of all, think about Ratania. You can think about sulfur. You can think about Aesculus. You can think about lacasis. You can think about Calcarea car. So see, there are a lot of remedies. Then see the quality of pain, the type of pain, where is the pain, how much every time he goes for stools, first stool, second stool, third stool. So there are different things you can you can think about. That is pain during stools. You can think about nitric acid graphitis and all. Pains after stools, the nitric acid, platina, ratenia, thuja, lycopodium, calcarea, a lot of remedies. Sir, 2 years child is getting vomiting whatever he eats after gets heated in sun. What should be given? Two things are there. If if you can prescribe only on vomiting, the body is trying to show this how is the vomit. It is watery, it contains mucus, it contains bile, it contains, it is green in color, it is yellow in color. You can prescribe on that also. But in acute case, when overheated, what happens, there is a lot of heat. If you go open the fridge and gulp some water, you can think about antim crude, you can think about naxomica, you can think about sulfur, you can think about gelsemium, you can think about lactasis also. Depends on, you can think about arsenic also if the vomiting is very offensive and cadaver smelling water vomiting. That's how you have to differentiate. Simple as that. Yeah, think about arsenic, think about natramure, watery vomiting. And see, in vomit, see something syphilitic, see the odor, see the smell, very offensive, then the remedy changes. Depends on the symptom the body is trying to show you. That's simple. Otherwise, every vomiting from sun, don't give natramure. We have antim crude also, we have naxomic also, we have arsenic also, we have gelsemium also. Okay. So let us go forward. So did you understand pain in the anus after stools? A lot of remedies try to break the symptom what the patient is telling you. Otherwise, we land up basically in the same remedies and we keep on increasing the potency and nothing happens. It is all temporary. Then they will also think about pain extension from the anus. It extended to the bladder, to the genitals, to the abdomen, to the pudenda, to the urethra. That also you have to think, to the gluteus muscles. This also, if you think, you can get a better remedy and a better individualization of the case. That's how basically I deal in my practice. Okay, let us go forward. Any questions which I have not answered? Yeah, so yeah, sir, patient has right sided lumbar weakness and pain usually when weightlifting. He says it's that way after the right side herniated disc surgery 10 years ago. See, the most important thing after an operation which lot of patients would suffer from is adhesions. Now this is a very common problem after any surgery. Adhesions, it may develop symptoms late or symptoms could be mild. With some painkillers the patient is better, with crocin or with some ultraset and all. But as the age progresses, this pain becomes severe and the adhesions become severe, and that pain, adhesions pain, becomes sometimes out of control. I have told you cases where I have treated adhesions where the patient was operated thrice for the adhesions and the doctor said now adhesions occur, it will be very difficult for me to operate. For adhesions, there are few remedies which are very important. I have got fantastic results with them. Think about calcarea floor, think about silicia, think about thiocinamine, think about lappa, think about graphitis, sulfur. These are the very common remedies I have used in my practice with very good results. Now you can also think a weakness of muscles after operation. You can add few remedies. You can add vitamin C30 potency, you can add Maxphos, you can add creatine 30 also in your case if you don't suspect adhesions. I hope you understood. A very interesting question and a very I would say interesting answer also I have given. You must have never thought about this condition. I have lot of cases, in fact doctors who have operated and now they are suffering from pelvic pain, uterus removed because of fibroid, and then diagnosed with PID, given a lot of antibiotics, nothing worked, and now they suffer from this type of complaints. Sir, for a heel spur, what should think? My dear friend, for calcareum spur, plantar fasciitis, heel pain, think about calcarea floor, think about ruta, think about ledampal, also think about Arenia diadana and squilla. If you open Mater Medica, it's beautiful sentence written for squilla that pain in the soul in shopkeeper girls. The girls who are standing in the shop for 8 hours, 10 hours, they get the pain, the remedy is squilla. So please do read about these remedies also. I have failed in my practice with common remedies. That's why I kept studying and then I came with these remedies, and that's why I'm sharing experience with you. So it is half an hour up. I hope you enjoyed as much as I enjoy sharing my knowledge with you. Until next Thursday for Instagram Live. Bye and thank you.